Hello, everyone, and welcome back to Intelligent Pod. I'm your host, Sophie Lane, and I am so glad you've chosen to join me for another deep dive into the ideas shaping our world. Today, we're exploring a topic that's both incredibly exciting and, let's be honest, a little bit daunting. AI in healthcare, promises and pitfalls. If you've spent any time reading the news lately, you've probably seen headlines about artificial intelligence revolutionizing the way we diagnose disease, design drugs, and even run hospitals. But with all this promise comes a fair share of challenges and even a few warnings. So in today's episode, we're going to look at the good, the bad, and the not yet decided when it comes to artificial intelligence in healthcare. We'll break down what's hype, what's hope, and what's already changing the lives of patients and doctors alike. Let's start by grounding this conversation. AI, or artificial intelligence, is essentially a set of computer systems that can perform tasks usually requiring human intelligence, like recognizing speech, interpreting images, and making decisions. In healthcare, that means algorithms that can sift through mountains of medical data to spot patterns, predict outcomes, or even recommend treatments. Here's a stat that really stands out. According to a 2023 report from Accenture, the global AI in healthcare market is projected to reach $194 billion by 2030. That's a tenfold increase from just a few years ago. The sheer amount of investment pouring into this space tells us that AI isn't just a buzzword, it's a rapidly growing force that's already leading its mark. But what does AI in healthcare actually look like? Let's make this a bit more tangible with some examples. Imagine a radiologist who, instead of manually reviewing hundreds of X-rays a day, is assisted by an algorithm that can flag potential tumors or fractures in seconds. Or picture an oncologist using AI to predict which cancer treatments are most likely to work for a particular patient, based on their unique genetic profile. There are even AI-powered chatbots now that can answer basic health questions, remind you to take your meds, and help triage symptoms. Sounds pretty amazing, right? And, to be fair, a lot of it is amazing. But as with any big technological shift, there's more to the story. So let's break down the promises and the pitfalls of AI in healthcare. Looking at this from a few different angles: the scientific, the psychological, and the cultural. Let's start with the scientific perspective. AI's biggest promise in healthcare is its ability to process and analyze massive amounts of data, far more than any human could handle. For example, a 2019 study published in Nature Medicine found that an AI system developed by Google Health could detect breast cancer in mammograms with greater accuracy than human radiologists. This isn't just a marginal improvement. In some cases, the AI actually reduced false positives and false negatives, meaning fewer unnecessary biopsies and misdiagnoses. But, and this is important, these results often depend on the quality and quantity of data the AI has been trained on. If the data is biased or incomplete, the AI can make mistakes, sometimes very serious ones. For example, if an AI is trained mostly on images from patients of a particular demographic, it may not perform as well when assessing patients from different backgrounds. This issue, known as algorithmic bias, is a huge concern because it can actually widen health disparities rather than close them. From a psychological perspective, there's also the question of trust. Would you be comfortable letting an algorithm decide on your cancer treatment? Or would you rather have a human doctor make that call? Studies show that while patients are generally open to AI-assisted care, most still want a human in the loop, someone they can talk to, ask questions, and ultimately hold accountable if something goes wrong. I recently read an anecdote about a hospital in the Midwest that introduced an AI tool to help predict which patients were at risk of sepsis, a potentially deadly infection. At first, some nurses were skeptical, worried that the AI might override their clinical judgment. But over time, as the tool correctly flagged several cases that might have otherwise been missed, the staff began to view it as a helpful second pair of eyes, something that could augment rather than replace their expertise. Culturally, the rollout of AI in healthcare also raises questions about privacy, consent, and the doctor-patient relationship. Who owns the data that's used to train these algorithms? How do we make sure patients' information is protected? And perhaps most importantly, How do we ensure that technology enhances, rather than erodes, the human connection at the heart of medicine? Let's dig a little deeper into the academic side. I want to highlight a fascinating study published in the journal The Lancet Digital Health in 2022. Researchers looked at AI-powered diagnostic tools for skin cancer and found that, while the top-performing algorithms matched or even exceeded dermatologists in accuracy, there were significant variations depending on the dataset. In other words, when the AI was tested on images from different hospitals or countries, its performance sometimes dropped. The researchers concluded that while AI has enormous potential, it's not a one-size-fits-all solution. It needs careful validation and oversight. So, what are some of the most common pitfalls we need to watch for? Here are a few that come up again and again. First, as I mentioned earlier, is algorithmic bias. If we're not careful, AI can amplify existing inequalities in healthcare, especially for marginalized communities. Second, there's the risk of over-reliance on technology. AI is a tool, not a magic wand. If doctors and nurses start to trust algorithms blindly, they might overlook important context or make mistakes when the tech fails. Third, we have to consider data privacy. Health records are some of the most sensitive information we have. Ensuring that patient data is anonymized, encrypted, and used ethically is absolutely critical. And finally, there's the issue of explainability. Many AI algorithms, especially those based on deep learning, can be like black boxes, making decisions that even their creators can't fully explain. For healthcare professionals and patients alike, that lack of transparency can be a serious barrier to trust. So, where does this leave us? How can we harness the power of AI in healthcare while avoiding these pitfalls? Here are some actionable strategies you can bring into your own life, whether you're a healthcare professional, a patient, or just someone interested in the future of medicine. If you're a patient, or someone who cares for a patient, don't be afraid to ask questions about how AI is being used in your care. If your doctor recommends an AI-assisted diagnostic tool, ask how it works, what the benefits and risks are, and how your data is being protected. Remember, you have a right to understand and consent to how technology influences your health. If you work in healthcare, embrace AI as a tool, but don't lose sight of your own expertise. Use these systems as a supplement to your clinical judgment, not a replacement. And advocate for regular audits and training to make sure that algorithms are performing fairly across all patient groups. For all of us, it's important to stay informed. AI in healthcare is evolving rapidly, and new studies, regulations, and technologies are emerging all the time. Following trusted sources like academic journals, reputable news outlets, and organizations such as the World Health Organization can help you separate fact from fiction. And finally, let's all keep advocating for responsible, ethical AI. That means supporting policies and companies that prioritize transparency, fairness, and patient privacy, and raising our voices when we see something that doesn't feel right. So to recap, AI in healthcare holds tremendous promise. Faster, more accurate diagnoses, personalized treatments, and greater accessibility. But we have to be honest about the pitfalls: bias, over-reliance, privacy risks, and the need for transparency. By staying informed, asking questions, and keeping humans at the center of medicine, we can work towards a future where AI truly serves everyone. Before we wrap up, I'd like to leave you with a question to ponder. How comfortable are you with technology playing a bigger role in your health? Would you trust an AI to spot a disease, recommend a treatment, or even provide mental health support? It's a conversation that's just beginning, and your perspective matters. If you enjoyed today's episode, I'd love for you to leave a review wherever you get your podcasts. It helps more curious minds find Intelligent Pod. For detailed show notes, links to the studies I mentioned, and more resources on AI and healthcare, just visit intelligentpod.com. And if you have thoughts, questions, or stories about your own experiences with healthcare technology, email me directly at sophie@intelligentpod.com. I always love hearing from you. Thanks so much for spending this time with me, and until next time, stay curious and stay well.